Good afternoon again. So I was talking to you. This is a continuation to part two of acute appendicitis talk I was giving you. I was talking to you that we have the option of either doing open appendectomy for acute appendicitis, or we can do the laparoscopic appendectomy. And I have also told you that if there is a lump formation, then you can withhold surgery. If you operate on a person who has got appendicular lump, which means he has got inflamed appendix, which is covered with a omentum, roofs of the intestine, and the cecum. So uh, you know, it's quite risky to operate such patients because if there is an injury to the cecum, there is a perforation, and this fistula continues for a pretty long time. Now, in laparoscopic appendectomy, it's better in the sense that the post-op care and post-op pain is less, morbidity is less, and patient returns to the work faster. But only disadvantage of laparoscopic appendectomy is that one has to give 2 or 3 incisions, one for the laparoscope and for the dissector also, and then dissectors. 3 generally. I use 3 ports. So in laparoscopic appendectomy, you have one advantage that you can tackle some other pathology like adhesions, etc., simultaneously on the same sitting, because laparoscope will give you a view of the entire peritoneal cavity, whereas the open method of doing appendectomy, acute appendicitis, your vision and your field of surgery is limited only to appendix, distal ileum, cecum, and right iliac fossa. So what I mean to say is that after you have done surgery, be available to the patient, take rounds, operating surgeon irrespective of his age. He may be a young person of 24 years, 27 years surgeon, or 30 years. In our countries, we have surgeons at a very, very early age. Unlike in some countries, one has to wait for 30 years of age or 45 sometimes. They have own compulsions and priorities of life. They have to. Here I'll touch this point also while talking to acute appendicitis. That kindly work very hard. Read, and read. If you read, you'll be a great, successful person. If you don't read, a lot of people will lose their lives. I'm telling you, out of ignorance. And if you can operate upon a person, well and good. If you don't, please do not keep these patients in your nursing home hospitals. Keep on giving IV fluids and antibiotics in the hope, as a layman, it will resolve and the patient walk back to home. Be truthful. There is no scope, chance, and there is nothing like misleading a patient, deceiving or cheating a person. If you can do a job, well and good. Please, for God's sake, don't tell lies in this profession. Not at all. Don't falsify your documents at any stage. And be clear to the patient, as if you're operating on your own son, brother, sister, mother, or things like that. If we mislead people, if we cheat people, if we deceive people, God forbid. Tomorrow, I don't know, this is a person who does bad to others, the circle comes back, starts, it takes a different turn altogether. Don't do it. In our profession, yes, of course, you should be honored, respected for your efforts. You can't live on water, air, or something like that. But do not demand anything. Do not be greedy. There are many people have come, I swear, and many friends, and few of them are those kind of people, who have got factories and manufacturers. They are good friends of mine. They were good friends of mine because I happened to save them in some kind of situation. So many things happened, and they wanted to compensate by giving money. I said, I'm an officer. I never do it. I give a commitment to my father, never take a gratuity. However, as a doctor, if you're doing a private practice, you expect what is authorized to you and what is your right, but nothing beyond that. There is no scope for you to accept any drinks and dinner from strangers, not at all. There's something in it. I have denied so many people. People come to me. I have a great financial powers once upon a time, an administrative post also. So you're invited for drinks and dinner and things like that. Here is the invitation. I said, what is your problem? You tell me the problem, I'll sort it without yourself taking the trouble of inviting for drinks and dinner and telling others uh, in one drink and two small packs of whiskey, you can make wonders. And I said, I'm not, very frankly, as to her, I said, you cannot buy me for a couple of drinks and dinner. Not at all. Nobody is there in this earth who can buy you. That should be your standard. If somebody forces you, all right, you are contrary. I think do not feel ashamed when somebody invites you for drinks and dinner. It's costing about 1,000 rupees or so. Take a gift of 2,000 rupees given to remind him that you are not available for sale. Not at all. I'm telling you, when the God Almighty wants to buy you, please keep him away. Pray, no doubt, pray to him. Keep him away if he wants to buy you. That should be your ethics. I'm talking to acute appendicitis. I was talking to the four guys. They want to give the money. I said no. I said, moment I accept money from you, I'll be your servant. I want to be on your head with my sympathy and human warmth. Don't do that. Then people come to you as recently as these Corona days. One guy comes to me. I happened to examine very because I was not keeping any distance and I was putting on masks and putting on gloves and things like that. Examine. He said, I've been to so many doctors and I was kept at bay at 5 meters. You're the person who's talking to me and this. And I said, you're putting on a mask, I'm putting on a mask. And then what he says, the old man, really, he was accompanied by his son. It was a little, he said, I want to give you money. I said, I don't accept it. He said, no, you have been very kind to me. Then his son tells me he's feeling too much, he wants to compensate you. I said, you become all right, that's my compensation reward. And there's another gentleman I happen to operate on. I don't want to name that gentleman. He was a minister. He was a minister. And his relatives came. Ministers, they are very, very rich people. And generally it was my habit to socialize people and talk to them and gather some kind of a good information. So they also used to sit down with me sometimes to come and sit down and talk with me, whatever it is. They found me an interesting person that way. Now he tells me I'm not lying. He said, sir, if you want 2 crore rupees, I'll produce it tomorrow. Really? I said, I don't take this money and these kind of money. Never, sir, never, not at all. You're a respected person. I said, how will you get it? He was very frank. He said, nothing. I'll tell one of the guys, these fellows, they are controlling, in our country, in some of the states, I'll not name it. They're controlling liquor trade. They're controlling transportation business of this thing and all kind of. No, I'm not going to go into those details. He said, left hand. I said, thank you very much. I want to impress for my students that your integrity should be very high. Though, of course, everybody who is looking forward to life looks forward to a decent life, no doubt. One should aspire for. Why not? If you are a hard-working person, you are working with your diligence, intelligence. If you make millions and millions of rupees, then nobody objects to it. Honestly, and reflecting in your tax returns, no doubt about it. But if somebody says, I want to give you money and can you do this thing? Thereafter, what I mean to say, let's come back to our story. In a person you have operated, follow him up twice a day. Even if you are sitting on a chair, you're head of the department, please go and visit. Because what you do, your youngsters will follow. If you don't go and visit, you don't visit the ICU, you don't take rounds, you don't go to the emergency, your youngsters will follow the same thing. So they'll be dishing out orders to their juniors. As professor to the assistant professor to the professor to associate, an assistant, then your senior resident, junior resident, then the intern. This is a common story. And take those people to task whom you have given instructions. That fellow is to be caught. Never catch junior fellows. Call head of the unit. Your guys are doing like this. Pull them up. You have to pull up people. You have to take duties, responsibility. The misery of our, anywhere in our profession, whatever it is. We don't go around. We don't take the rounds. We don't go to casualties. Youngsters are making mistakes. The patient lying in casualty for hours together. They're busy writing note down. My dear friends, firstly attend and resuscitate the patient. And this writing work can wait. And there's no guidance to him. Please, youngsters require a lot of guidance. And if becomes a doctor or surgeon without being guided, just holding retractors and listening to some kind of a clinical meeting or journal club and case presentation, then no, on the ground practical reality. Thereafter, what you do is have the phone number of the patients, discuss with them, talk to them, how are you feeling, and things like generate goodness. It spreads all around. It's a message. And thereafter, whatever work you're doing, your OPD ticket, the name of the patient, the age of the patient, the sex of the patient, the complaints, your examination findings, briefly, your investigation, the treatment you have written, and the signature. Signature should always be supported by your identification, either the stamp or your name in writing in capitals, and keep a record of it, right? So with these words, thank you very much. And go back, I want to tell you one thing, is that when you are in your room or something like that in hostels, for God's sake, yes, of course, you have to read, no doubt, but develop and cultivate a habit of having group discussions. Group discussion, talk among yourselves. This will make a permanent impact and make you a better student. You'll not forget these things in your examination. A thing which you read, because once you're sitting in, you're reading, and your priorities in life are a little different. You're thinking something of this, and all kind of thoughts come to mind, good and pleasant and happy or this thing, but not at the cost of your duty, responsibility, and the books you're reading. So sit down together, discuss among yourselves. That will make you wiser. And with these words, I hope you please just give me a feedback. My talk is directed to one specific group of students I'm talking about. I'm supposed to take a talk for you. Please give me the feedback. You must be very frank and do not hesitate telling me, go slow, repeat, repetition is the most important thing. So I can correct myself at any stage. All right, you please tell me, how do you like my talk? Does it require any kind of addition, deletions, or something like that? And with these words, I wish you the best, and God bless you all.